Audits and inspections in clinical research. What is a GCP audit? It is a systematic and independent examination of trial-related activities and documents to determine whether the evaluated trial-related activities were conducted and the data were recorded, analyzed, and accurately reported according to the protocol or sponsors SOP and good clinical practice guidelines and applicable regulatory requirements. Determining the subjects, timing, and methods of audit, information in the audit plan. It is very important questions. Designing and updating the audit plan is essential to systematically, effectively, and efficiently conduct a GCP audit with consideration of research management in the auditing department or for independent GCP auditor. What is the difference between GCP audit and GCP inspection? Inspection, this is an act by the regulatory authority of conducting an official review of documents, facilities, records, and any other research that are deemed by the authority to be related to the clinical trial and that may be located at the site of the trial, sponsors, or CRO facilities. Other establishments deemed appropriate by the regulatory authority. What is the difference between GCP audit and inspection? In GCP audit, inspectors are employed of the company who work for active clinical quality assurance function. And GCP audit is done to ensure that the site is complying with protocol, SOP, GCP, and applicable regulatory requirements. In GCP inspection, inspectors are employed by the government through the agency of the regulatory or competent authority. And GCP inspection is done to ensure that trial-related obligations are acceptability of resultant clinical data. Who can GCP audit a clinical trial? The following entities have rights to conduct the audit inspection at site based on regulation. So FDA, OHRP, the sponsor of the clinical trial, or cooperative groups, RRB, and institutions. What triggers an GCP audit? In connection with the clinical study, an inspection may be undertaken if there are concerns about safety, data, or ethics, monitor standards of clinical research, when there is a suspicion of fraud or scientific misconduct, when there is serious quality systems breakdown. What all can be audited or inspected? First of all, it's site and investigators and study team, IRB, sponsor, CRO, laboratories, pharmacies, devices. Why sites are GCP audited and how? First of all, it's routine audits, study-oriented inspection. To ensure that the site is complying with protocol, SOP, GCP, and applicable regulatory requirements, this is referred as a routine audit. Second, it is for-cause audit. If the site is out of compliance and the sponsors want to either verify the problem or to be reassured that no problems exist, this is referred as for-cause audit. Routine audit by FDA, by sponsor, in-house, CRO, or cooperative groups. For-cause audit by FDA or CRO. Allegations, suspicion of non-compliance, safety or efficacy data is inconsistent with other study sites, PI conducting research outside area of specialty, equal or abnormally high for geographical or ethnicity, race, location. When can a site be audited? At any time during the study, after the study is complete, prior to regulatory approval for the product, at any time after regulatory approval if a safety concern with the product. On what basis the sites are selected for an audit? Study-oriented audits, patient enrollment, patient retention, adverse events, trial importance. Pre-audit procedures. CRC preparation. Also, it is very important to know that designing and updating the audit plan is essential and very important. Audit plans such as an annual plan and monthly plan and a plan specific to each trial or audit should be established based on consideration of the goal, contents, and timing of GCP audit, the progress of the targeted trial, and other relevant factors. The audit plan should be updated in accordance with progress of the trial or auditing activity. Prior to conducting of a GCP audit, the auditors and the auditee will discuss and adapt the audit plan if necessary. Determine the subjects, timing, and methods of audit. The subjects like medical institution, CRO, system, clinical trial report, computerized system validation, timing, and the methods like sampling, interview, or tour of an audit should be determined based on the goal established for the audit. CRC preparation. Notify all staff involved in study about the audit with date, time, and duration of the audit. Ensure the investigators' attendance during the GCP audit, reservation for quiet, comfortable place to work and to assemble the necessary documents for GCP auditor. Defined SOP should be present and properly reviewed by all staff involved in trial before audit about interaction of auditor with site from his welcome to exit. Assemble all study documents in one place. They should be complete and well organized. Ensure accessible photocopy, provide a backup if necessary. Confirm about the CRM presence during the audit and review all the essential documents or any other problem which is found during this review so that the situation may be able to be remedied before audit. CRI preparation. Review and verification of every essential document should be complete and properly placed. Ensure resolution of unresolved queries before audit. Notify confirmation of audit agenda to site for conduct of audit at selected site. GCP auditor preparation. A GCP auditor should have an audit plan. Auditor may also prepare working documents for use during audit. Sometimes it becomes necessary to generate audit-specific working. Notify conduct of audit to CRI and site. What happens during audit? Auditors present their credentials and notice of inspections form to the clinical investigator. Conduct introductory meeting. GCP auditor will start auditing by reviewing specific data related to trial study and regulatory requirements. They will document all their findings. Auditor also interview site staff directly involved in trial activities and process. What happens during GCP audit? Auditors' common observations for the study: protocol non-adherence, inadequate and inaccurate records, failure to report adverse events, failure to report concomitant therapy, inadequate drug accountability, RRB and problems, informed concerned issues. What happens during GCP audit? It could be closing meeting, exit interview. At site visit completion, auditor conducts exit interview with all responsible site personnel to review findings, clarify misunderstandings, describe any deviations from current regulations, suggest corrective actions if appropriate. FDA auditor may issue a Form FDA 483. What happens after audit? After the audit is complete, the GCP auditor prepares an audit certificate, audit report, or classification like NAI, VAI, OAI. What gets audited? Regulatory and protocol compliance, subject, records, investigational product, adverse events, or complications, documentation. Inspectors should present a Form FDA 482 notice of inspection, have all subject records organized and available, give the inspected only those records specifically requested, make scrupulous notes of comments, pointed out by the inspected. Question entries in the inspector notes regarding adverse findings. If the question seems vague, ask for clarification before answering. Make sure the inspector understands your response. It is very important for investigators. Also, but don't even think of giving more information than asked for. Offering to change data unless it can be verified with the sponsor and supported by source documents. Discussing other studies, discussing financial agreements between you and sponsor, hiding information or volunteer information, signing affidavits, allowing pictures, leaving the inspectors alone, and so on. Thank you very much.